Okay, we wanted to finish up talking about Chapter 11, and the next topic is the electrocardiogram, which is how physicians look at the electrical activity that coordinates the beating of the heart. And essentially, it correlates to the contraction and the relaxation of the heart by sending a depolarizing wave through the myocardium that begins with the atria and then continues with the ventricles, okay? And following that electrical wave, the upper chambers first squeeze and then the lower chambers squeeze. And then a next electrical wave allows those chambers to relax. A basic ECG recording is made when the patient's at rest. 6 electrodes with leads are attached to the chest and 4 more to each extremity. So you've got one on each leg, one on each arm. Okay. The tracing contains a series of waveforms. Okay. The first waveform is called the P wave, the second is the QRS complex, and the last is the T wave. The P wave represents the electrical signal that's going to result in the atria contracting, which is a process called systole. Okay, and that P wave is a depolarizing wave. Remember that all living cells have a separation of charge at their membrane called polarization, which is maintained by the sodium-potassium pump and the leak channels, and the fact that large negative ions are trapped inside the cell. Well, when this event happens, we upset that balance by opening up tunnels that let positive charges flow towards negative charges. So these allow the movement of positive ions into the cell, and that depolarizes the cell, and that rapidly moves across the middle layer of the heart called the myocardium, and that results in the atria squeezing. Okay, so we call it atrial systole. The next event is that the signal will wait at the top of the ventricles at a location called the AV node for the upper chambers to send blood to the lower chambers of the heart, which are called the ventricles. And then the signal very quickly moves from the AV node down the wall between the two ventricles, which is called the interventricular septum. And then when it gets to the tip of the heart, called the apex, it moves slowly up the walls of the ventricles through conducting fibers that are called Purkinje fibers. And this whole set of events is called the QRS complex. And it's followed by 2 mechanical events, ventricular systole and atrial diastole. Okay, ventricular systole is just the lower chambers squeezing, and atrial diastole is the upper chambers relaxing. Okay. The last wave to occur is the T wave, and it represents ventricle repolarization, and that's followed by the lower chambers relaxing, so we call that ventricular diastole. So you can see here the typical ECG, the waveform is up here. Okay, so you can see here what the waveform looks like. Okay, and you can see the P wave, the QRS complex, the T wave right there. Start with the P wave. The depolarizing wave moves across the walls of the atria, right? And that's followed by the atria squeezing. Okay, that's them in green. Okay, and then the QRS complex, the signal rockets down the septum and then radiates up the walls of the ventricles through the Purkinje fibers. And what follows that signal, here indicated in yellow, is the squeeze coming from the apex all the way up to the base of the heart. Okay, and then we end with the T wave. Okay, the T wave is this last guy here, and that represents the diastole of the ventricles, right? So P, okay, begins up here, okay? This is the first firing, okay? It moves across the right atrium, across the walls of the right and left atria, okay? The P wave completes, okay? Completed here, right? And then that's followed by systole of the atria. Then the QRS complex results in relaxation of the atria and contraction of the ventricles, which is what you see here in green. And the T wave results in ventricular diastole, and then they relax. Okay? Different intervals are important for cardiologists to understand whether or not the conducting system of the heart is doing its job. The PQ interval is the conduction time from atrial excitation to ventricular excitation. The ST segment begins at the end of the S wave and ends at the beginning of the T wave. And the QT interval is from the beginning of the QRS complex to the end of the T wave. Okay, so you can see again the different waveforms. Okay, you can see what these waveforms look like, all right, and they reflect three things about the electrical signal of the heart. Okay, the height of the wave represents the strength of the electrical signal. The spikiness of the wave represents the speed of the electrical signal, and the direction of the wave represents which way the electrical signal is moving relative to the electrodes. Okay? So you can see again a summary in 11.2 in your book of the different waveforms and what they mean. Now sometimes this goes wonky. Cardiac dysrhythmias have three basic patterns. They're results of disturbance in heart rate. Bradycardia is a heart rate under 60 beats a minute. Tachycardia is a rate over 100 beats per minute. Disturbances in conduction pathways are going to result in irregular heart rate, and this can be the result of an ectopic focus, which is a collection of heart muscle cells that disobey the normal pacing of the heart. Okay. Another example of an arrhythmia is a heart block, where we don't get the signal from the AV node down to the bundle of His and the right and left bundle branches, which are embedded in the interventricular septum. Okay. If this is a persistent condition, this is lethal. All right. Other irregularities. Okay. In a heart block, the PR interval is longer than normal because of increased time for impulses to spread to ventricles through the AV node. Extra P waves are present, and this indicates that some action potentials from the SA node aren't being conducted through the AV node at all. Another common location for heart blocks is along the right or left bundle branch, and this widens the QRS complex because depolarization takes longer to happen. In fibrillation, what happens is that the chambers essentially quiver and don't engage in any real pumping action. Now, atrial defibrillation isn't good, but it's not lethal, because 70% of the ventricular filling comes from gravity. But VFib down here is something that you got 5 minutes to fix, or else you get permanent brain damage and then death. And the way you do that is with a defibrillator. Okay, if you're walking through where you work or you go to school, you might see a glass case embedded in the wall with the red letters AED on it, and that stands for Automated Electronic Defibrillator. And all you have to do with an AED is to open the glass case, pull the little suitcase out and open it up, and it literally talks to you and walks you through the entire procedure. So you don't have to know anything in order to use it. Ideally, following treatment, the SA node resumes pacing the heart. Okay. Other irregular heart rate manifestations include a myocardial infarction, caused by blockage of the coronary arteries, which provide blood to the heart itself. This can kill heart muscle tissue and can kill the individual. The pain is often described as pressure or fullness in the chest. Frequently in men, it radiates down the right shoulder, arm, jaw, and neck. Okay? In women, sometimes it manifests itself differently. Other signs and symptoms include shortness of breath, sweating, nausea, and dizziness. You can see some of the differences between MI in women and men here. Okay, so this is 11.3 in your book. Okay. Angina pectoris can be caused by a narrowing of the coronary arteries. It's not life-threatening, but it can be a caution. The pain is described as a tight feeling in the chest and can be brought about by stress or physical activity, where it's called stable angina. Pericarditis is an inflammation of the pericardial sac that results in sharp, localized pain in the chest. It's not life-threatening, but it needs to be treated. Pleurisy is just an inflammation of the membranes that surround the lungs. It is extremely painful in this case to breathe because there's less than normal pleural fluid, which is the lubricating fluid that normally allows the lungs to work. And heartburn is the result of acid from the stomach entering the esophagus, and you can experience a burning sensation in the chest. It has nothing to do with your heart. It's sometimes referred to as GERD and is frequently seen in patients that are obese or are pregnant or in the aged. Panic attacks can result from stress or fear, and they can be accompanied by an increased heart and breathing rate, and that's brought about again by the influence of the sympathetic division of the autonomic nervous system. Costochondritis is inflammation at the junction of the rib bone and the sternum. Pulmonary embolism is a blood clot in the artery and lungs, results in severe, sharp pain and increases when you take a deep breath or cough. Myalgia is just strained or injured muscles. Broken ribs, of course, are fractured bones of the thoracic cage, and they produce a localized chest pain. And inflammation of the gallbladder is associated with pain, usually localized between the abdomen and spreading to the chest and even up into the shoulder blade. Okay, and that's a condition known as referred pain, where the pain is actually felt at some distance from the organ that is actually in pain, similar to the pain down the left jaw, shoulder, and arm of men having a myocardial infarction. The ECG is used to determine if someone is experiencing a heart attack in their past. A stress test is just an ECG performed while the patient is exercising. Blood tests can indicate if the heart tissue is damaged, because when that occurs, it dies and releases enzymes into the blood that we can detect, including creatine phosphokinase and lactate dehydrogenase. And a chest x-ray simply shows the size and the shape of the lungs and the heart. A nuclear scan usually follows the introduction of radioactive substances in the blood vessels of the heart and lungs to look at narrow or obstructed arteries. Okay, this is called an angiogram. The electron beam computerized tomography, or CT, is a three-dimensional scan of the arteries, again for finding things like leaks or arteries that are choked off. A coronary cath uses contrast medium that flows through coronary arteries to look for obstructions or leakages. And an echocardiogram simply uses sound waves in order to see any shape defects in the heart that result again in abnormal heart sounds. While endoscopy is the insertion of a tube with a camera on it down the throat and into a hollow organ in order to observe any damage from the inside out. An arrhythmia or dysrhythmia, as we've already indicated, is just an abnormal heart rhythm. Electrical impulses of the cardiac conduction system don't travel their normal route. We see dyspnea, dizziness, or fainting, and a rapid or slow heart rate or a fluttering feeling in the chest accompanied by pain. We treat the underlying cause. Treatments can include pacemakers, meds, cardiopulmonary resuscitation, vagal maneuvers such as holding your breath, electric shock, radiofrequency cath ablation, and a defibrillator, and surgery to correct any heart defects. Congestive heart failure is just the inability of the heart to effectively pump blood because of the high resistance against which it has to work. Risk factors include smoking, being overweight or pregnant, lack of exercise, a history of heart attack in the past, hypertension, damaged heart valves, alcohol consumption, and diabetes. In left-sided heart failure, what happens is that the blood coming back to the heart from the lungs is slowed up, so it accumulates in the lungs, and that results in fluid in the lungs. We call that a pleural effusion. We frequently see lightheadedness accompanied by kidney failure, shortness of breath, pulmonary hypertension, and a cough. In right-sided failure, you get fluid accumulation in the systemic circulation. So in the wrists and the ankles, we call that peripheral edema, and we can also see it in the abdomen. We frequently see loss of appetite, which leads to cachexia, which is a skeletal appearance due to lack of body fat. How do we treat? We use meds to slow the rapid heartbeat, diuretics to reduce blood volume and pressure and to decrease edema, and meds to reduce blood pressure that can act on things like vasoconstriction. A heart attack is just where the cardiac muscle dies as a result of lack of blood flow, and it won't be replaced by normal heart tissue. It'll be replaced in that case by scar tissue. That makes the heart weaker from that point on. Obstruction of the coronary arteries is a frequent cause. This can result from atherosclerosis or a thrombus or an embolus. A thrombus is an immovable clot, and an embolus is a traveling clot, and either one of them can jam in a major vessel that feeds blood to the heart itself. We see chest pain, pain in the shoulder, arm, back, teeth, or jaw, pain in the upper abdomen, shortness of breath, especially when you exert yourself, diaphoresis, dizziness, nausea, and vomiting. Frequently we give an aspirin at the onset of symptoms to act as an anticoagulant in order to cut down on the number of emboli you produce because the blood flow has slowed as a result. In an unconscious patient, we use CPR. An AED and thrombolytics can also aid in this event. An angioplasty or coronary artery bypass can essentially route the blood around the damage and restore blood flow to the organ, but unfortunately the damage to the organ is permanent. One of the things that happens as we get older is that the cardiovascular system does not improve in its performance. Arterial elasticity is much less at age 70 than 20. As a result, hypertension is a frequent condition you have to battle. The heart has to work harder as a result and can frequently fail. The heart rate decreases with age and the cardiac cycle gets longer. The heart can hypertrophy and become weaker as a result, and the valves can thicken and calcify and become leaky, and that results in a reduction in cardiac output. And there's nothing you can do about that, but what you can do is to reduce the damage that accumulates in the heart by engaging in a sensible diet and exercise program. If you put on lean muscle mass as body weight, you actually grow more blood vessels, and that reduces the force against which the heart has to work, and that's going to make the heart last longer than it normally would. So we recommend resistance exercise for people 65 and up, at least half an hour a day. Okay, we'll test over this during the next class period. Make sure to, if you have any questions, to ask me, and I'll see everybody when we're back in class. Thank you.